Hi, it's Karen Smith with a little bit of wound bed prep. When you're looking at this particular thigh wound, the wound on the left is nice and clean. You can see down to the muscle, and there's no necrotic tissue within this wound base, and you're just simply awaiting some granulation tissue. Several dressing options for that wound. So in terms of debridement, this particular wound needs absolutely none. This thigh wound, on the other hand, has quite a bit of different colors in it. It has quite a bit of necrotic tissue. It has some kind of some flaky beigey yellow brown things of necrotic tissue. It also has some crusty edges where you can tell that the wound has contracted, that the myofibrils have contracted and caused the wound to become smaller. It's taken an initial wound and it's kind of smoothed the edges around it. And so we'll take, for starters, we can decide what type of debridement we might want, and with this patient not having any contraindications to sharp debridement and their pain under control, perhaps they've been pre-medicated and the patient's mentation will allow you to debride, then you may want to come in and start kind of doing your assessment. You may look at the wound edges to see if any of this material is loose at all. We're trying to minimize any type of wound bleeding during the process. We'll try to get up under. I can get up underneath this one a little bit. This one's pretty stuck down. You can determine if it's a thin layer or a thick layer. This particular eschar seems very, very thick. You can determine if it is within the wound bed, if there's necrotic tissue underneath it. Like here you have some black necrotic tissue, and then you have some thicker white necrotic tissue. Maybe it's a thick slough that is on top there. Now what makes the difference, sometimes what makes the difference in different colors within a wound and the eschar is if it is more hydrated, it'll be more white-gray than if it's more of a dried out wound. It might be more of a darker color. But even in some wounds, you will have very hydrated wounds that have some dark black or brown color to it. As I try to lift underneath this hard adhered black eschar, I'm not getting anywhere. So that lets me know that it would be sharp debridement if I remove something with the pickups. But I'm going to have to do something other than just take my pickup and pull. I have picked up this little piece here, but it is stuck on the remaining border. If I kind of get in there a little closer, I can see that I can get underneath here. But if I go to pull it too much, how many times have you scratched a little scab or something and then kept pulling until it finally bled to where you've really disrupted that particular wound area? So you get some choices. Your first choice would be to lift up and be able to trim right next to the wound bed, and then take that little piece that you trimmed off and remove it and put it on your 4x4. And so you can see that you didn't cause anything to bleed, and that particular area is cleaner and going to do well. So you've got little flakes here that you can decide if perhaps maybe by tomorrow it'll be a little bit looser. So if you're doing a series of debridements, then that would be a good idea there. Okay, you have these larger areas of slough that you could lift up a little and potentially trim just little bitty pieces to see. Now you would be having these two blades trimming underneath tissue that you're really not sure where you're trimming. So that would be the reason that sometimes using a blade is a better idea. So if I'm going to pick up the edge here from a model, that piece was so dry that it just kind of shot off, and so you can just remove it. So we got lucky on that one that would just remove that debris, and you were ready with the scalpel, but it wasn't required. So that would be wonderful. Then you've got this big piece in the center. Oh, it is really stuck, but you feel like it's a thin layer. So your choices are to come underneath here. Try if you can lift up a little side, and you can tangentially shave, and as long as you can see it, you can begin shaving that way with your blade. That was a 15 blade. Some other choices that you have for blades. Might be the 11 blade, which when I pick this up and I begin to shave, that is very pointed, so that's probably not going to be a great idea. An okay blade that's often found in the supply closet is the 10 blade. It's a very big blade, and it does have a sharp area from here all the way to the tip. And so as I lift up, I could very much use a 10 blade. That a lot of times that may be what is in the hospital for you to select from, or outpatient clinic. But on this small wound, in many of the debridement kits, a 15 blade may be what comes in your kit. And so you can turn your blade and trim just a little bit, and if you get to a section that you really feel like if you cut any more that it's really gonna bleed, then you can either trim with the scissors, or you can trim just like this and remove that section of eschar. And you can see that underneath is some granulation tissue trying to pop on through, and that may have been why that area was a little bit looser and you were able to get to it. How much debridement do you do? Well, how much does the patient truly tolerate? You have them positioned well. You actually have, a pillow under their knee. Got them pretty comfortable, kind of partially on their side, maybe a pillow behind their back to keep them there. And you're talking to your patient, how are you doing? And then you may be able to just pick up an area. Now, if I use a 4x4 of gauze and I go in and I just start, I feel like if I just rake that section off, that it would just come off. It just looks like loose enough if I could just get it, and it just fell off. That's not sharp debridement. That's called mechanical debridement, that I mechanically rubbed it and removed that debris. Okay. If it's adhered a little bit and I have to use the pickups, sharp debridement. If I have to go in with the scissor and lift up a section, I can get this. This one's picking up nicely without the scissor, but I see a spot here that's a little bit loose. I think I can get it. Very nice. Then it's sharp debridement, and you can use those debridement codes in your billing. There's a section similar to what we used before that we feel like we need to just leave part of it and let it come off tomorrow. And so as you're cleaning up your wound, you get it loose, you can just come out with it Very nice, very, very crusty area. And so for today's wound care, and you can go ahead and irrigate with your, this is 0.9 sodium chloride, which is normal saline, or one of the great choices is the hypochlorous acid products that are out now. They don't sting, they don't hurt, they don't have to be rinsed out, and they add some debriding and antimicrobial nature to the wound, whereas sodium chloride is simply an irrigant. It doesn't actually have an antimicrobial action. It works by just having the water flow, and as the water flows through the wound and irrigates, that it might remove something as it is flowing away from the wound. Do you need to totally have a wound 100% clean in order to call it a debridement? No, you just do what the patient can tolerate, what you as a therapist can tolerate, and then you may need to use more than one type of debridement. Today we did mechanical debridement and sharp debridement. We have an option of putting a dressing on here that would assist with autolytic debridement. We have an option of adding products like honey. The medical honey has some debriding ability, and we have hyperosmotic products that are high sodium content that are debriders. There is wet to dry, where you would wet a piece of gauze with saline and put it on the wound and then let that dry and then pull it off and see if it pulls off some necrotic tissue. That is the oldest form of mechanical debridement, and now with advanced wound dressings we try everything but that, literally, for wound care. And so we could also use some of the wound vacs or negative pressure wound therapies that has some ability to facilitate pulling, keeping the wound moist and pulling the granulation tissue towards the top, and it has some ability to facilitate debridement also.